Historically, there was not that much need in NHS to communicate electronically. I mean, there was not much electronic communication anyway years ago. But nowadays, NHS is moving into area of cooperating with local councils and other health providers. Additionally, CLCH is a community health provider, and therefore we have lots of sites all over London, and we have lots of people who actually come and visit patients at their homes. So we have great need to communicate personal identifiable data securely, even though the recipients might be outside of the NHS network. Hence the need for encryption in order to do it in compliance with Data Protection Act and all the other UK legislations required, which we need to comply with. CLCH started looking at various email encryption technologies. We've been looking at Egress for quite some time, together with other systems which we were piloting for a number of years now. When the contract came from renewal, we've decided to switch to Egress. The main reasons are that Egress is a UK-based company and it has CSG certification. CSG is effectively the security arm of UK government, which makes usage of Egress technology very secure. The other important factor of using UK-based company, absolutely, apart from the fact that Egress is certified by CSG, the very fact that this is UK company means that we don't have a major issue with Data Protection Act. Companies which are not UK-based, although that this is not certain, but we always have to take into account possibility the data may transgress the European Community's boundaries, and that would be triggering the 8th principle of Data Protection Act, and it would require additional work to make sure that we are compliant. So using Egress makes it much easier for us. We were looking for a system which is very easy to use. Effectively, because of the NHS workforce busy treating patients and going about the business, we didn't want to introduce another technology which, on top of all the new things which are coming out, all the new iPads and other things, which create enough distraction, we didn't want to add anything to it. So Egress is very, very easy to use. Effectively, you only mark email as private, personal, confidential, and the rest is taken care of in the background. So users are using Outlook and emails as they are used to, and only from the governance perspective and policy making is very straightforward as well, because you don't need to specify effective encryption. You just specify that people mark emails in the fashion as they're supposed to be marked. So in other words, if they are personal, they're marked as personal, private, confidential, and that's all what's required. The use of encryption obviously reduces the need for transferring information in paper form, so it makes it more secure, it reduces the cost, and effectively improves the patient care, which is what we are all about here. Users were surprised how easy it is. That probably best describes the whole thing. Everybody expects that they need to actually go through some complex process to encrypt emails, and they couldn't believe that just marking email as personal, private, and confidential does the trick. So frequently it's just disbelief that works that smoothly. We obviously the email encryption technology will stay, because that's something which proved to be very valuable to us. But on top of that, we are looking at ability to transfer very large files in and out of the trust. So we can leverage Egress technology instead of using a secure file transfer protocol. And we can also use something which is, well, best described as a secure web forms, allowing patients to send their own data to us, even if they don't understand how this is done, but that's done securely as well. I think that the thing which strikes me most is the eagerness to help, friendliness, very high level of technological know-how. That is very important in a very sort of diverse and difficult field we are working, because we work mostly with people, patients, clinicians, and to be able to understand their needs, it's critical. And we get that support from Egress, which is fantastic.